One thing we see in a lot of folks that are over the age of about 50 years old is nerve pain of the feet. All right, so what are some of the biggest things? There are so many issues potentially that could be causing pain in the foot. How can you tell if this is just straight nerve pain, like the nerves are damaged, or how can you tell if it's plantar fasciitis or something like that? So pressure is not a good indication, because both pressure can hurt a lot of different things. And what I mean by pressure is just poking on it or standing on it. And so there's a few key indicators that I always try to look for, really one or two major ones that if I hear, I'm like, man, you've got nerve pain, or at least some degree of nerve pain. Now, if the pain is accompanied by numbness and tingling, many times that's nerve pain, especially if it's just lower extremity down. Sometimes you can get things like sciatica, etc., that just simply cause foot pain, and you won't have any leg pain, maybe not even any much back pain. So it's a little tricky. But again, if you're treating the right things, you're going to cover a lot of the bases anyway. But so nerve pain, again, one of the biggest things about nerve pain that I always tell folks, if you have pain at night, okay, if you have pain at night, not when you're on your feet, but if you're pain at night, like if you don't feel pain, then you get into bed and then your feet start to just ache and burn and just become very electrical in nature, or the blankets or the covers of your bed just really aggravate the heck out of your feet. That is almost an absolute indication that you have neuropathic nerve pain, so neuropathy pain, okay? If it's at night, all right? Also too, if you're on your feet for long periods of time and your feet don't hurt, and then you may just kick your feet up and just relax a little bit, and then all of a sudden your feet start bothering you. Again, like if you're kicking back in a recliner at the end of the day and your feet don't hurt at all, you kick back and start to relax, and then all of a sudden it just starts to fire and starts to get super painful. That again can be neuropathy pain as well. Now again, that could also be some other pains, and I'm not saying one is indicative of the other. This is why a good exam is always important, or just talking it out is very important. But pain at night. So the reason that it's important to know if it's nerve pain or plantar, because it determines the type of treatment that you should get. If you have plantar pain, which we have had patients in our office, I can't tell you how many times have been treated for neuropathy or on drugs for neuropathy, have been in other offices for neuropathy, and meanwhile they have plantar fasciitis pain. And so the treatments are different. There needs to be things added, maybe not added in the others, et cetera, et cetera. So pain at night, shooting, stabbing pain that increases very, very rapidly and then can go back down with really you not doing anything at all. These are some very key indicators that it could be nerve pain. Something too that it just is constant all the time. Like no matter what you do, if you're on your feet, off your feet, nighttime, daytime, no matter what, and it just hurts like heck, that's another thing. Also too, just the severity. Now, if it's so severe and it's just, again, it's like the only thing that helps is for you to put ice on it and there's nothing you can do about it, that again may be nerve pain. And so, and what I mean by nerve pain, I'm talking about like peripheral neuropathy pain, etc. Now again, peripheral neuropathy can be caused even by sciatic issues. So like your sciatic nerve becoming crushed or impinged upon or irritated or whatever, that can actually cause a type of neuropathy as well. So we have to understand, A, is it neuropathy? And then B, what is potentially causing it? So that way you can take care of, try to figure out ways to treat it. And not only treat it short term, but treat it long term. So that way this doesn't, because this is a chronic issue. If you start to get nerve pain and it's like a neuropathy pain, that is something chronic. And the reason that's a big deal is because chronic things don't ultimately go away just because the symptoms are gone, right? Like arthritis is a chronic issue. And just if your back doesn't hurt doesn't mean you don't have arthritis. It means the arthritis is in there. It's just not inflamed currently, which is going to, trick a lot of people and think, oh, I'm feeling better, I'm going to go do whatever I was doing before, and then they end up in the same boat, if not worse. And so this is why I'm adamant, always adamant, for anybody who has these chronic types of conditions, arthritis, neuropathies, etc., to continuously try to maintain the treatment to some degree to keep those symptoms at bay and to make sure that that body is constantly healing, whether it's a nutrient, whether it's blood flow, whether it's oxygenation. There's so many ways that these types of things can be treated, but they just have to be continuously revisited. You can't just go back to the lifestyle that started the problem in the first place and expect that to never come back.